Hello, good morning. My name is Tiana Jackson. I'll be conducting a head to toe assessment today. Today is October 26, 2025. This is my patient, Sincere Anthony. She gives me full consent to do a head to toe assessment. So this is for the fall 2025 for Dr. Perry. So first I'm going to start off by doing a 360 of the room. My supplies are right there. All right, and then this is the floor, and then the ceiling. Okay. Okay. So first I'm going to start off by inspecting the skin. The anterior, posterior, and abdomen has already been inspected due to patient's privacy. So first we're just going to go for the overall appearance. The color is appropriate for ethnicity. The temperature is warm. The texture is smooth. The moisture is dry. There's no bruising, no scarring, no lesions or nevi noted. The turgor is elastic. So then I'm going to move on to the head. The head is midline and symmetrical for body type. So then we're going to move on to just looking at your hair. Your hair is equally distributed throughout. There's no, the hair depression looks appropriate. I'm going to go ahead and palpate your scalp. There's no masses, no tenderness, or infestations noted. So then I'm going to move on to palpating the temporal arteries. Okay, there's no tenderness noted there. So then I'm going to move on to palpating the lymph nodes. So I'm going to start with preauricular, postauricular, occipital, tonsiliar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. Okay, and those no nodules noted there. So then I'm going to move on to palpating for TMJ. So I'm going to get you to open and close your mouth. All right, there's no crepitus, no subclavians or tenderness noted there. So then I'm going to move on to cranial nerve number 5 for trigeminal. So I'm going to test for motor. I'm going to put my hands on your masseter muscle. I'm going to get you to clench your jaw. All right, and then we're going to also test for sensory with cranial nerve number 5. So you're going to let me know where I touch you at. Go ahead and close your eyes.
Forehead, cheek, chin, nose.
All right, cranial nerve number 5, trigeminal is correct. So then we're going to move on to cranial nerve number 7, testing for a facial. So I'm going to get you to smile, frown, raise your eyebrows, puff your cheeks out, pucker your lips. Cranial nerve number 7, facial symmetry is intact. So then we're going to move on to the ears. I'm inspecting the ears, making sure they're appropriate in size and position for a patient, which they are. So then I'm just going to palpate the tragus and then the pinna. There's no masses, no tenderness noted there. So then I'm going to move on to inspecting the auditory canal and the tympanic membrane. And I'm going to use that with my otoscope. All right. I'm going to take a peek back. Okay, I'm going to go to the other side. Okay, the auditory canal is clear and the tympanic membrane is pearly gray. So then I'm going to move on to cranial nerve number 8, hearing for my hearing test. So then I'm going to first start out by the whisper test. So I'm going to whisper a few words and you're going to just let me know what I say.
Cat, dog.
Okay, good job. I'm going to go to the other side.
Tree, house.
All right, whisper test is intact. So then we're going to move on to our Weber test, testing for lateralization. I'm going to use my tuning fork. I'm going to put it at the top of your head and let me know if you hear it from both sides.
Yes.
All right, Weber test is intact, no lateralization noted. So then I'm going to move on to my Renee test and testing for air and bone conduction. So I'm going to put this against your master bone and on the side of you. You let me know which one you hear louder, 1 or 2.
2.
Okay, good job.
2.
All right, good job. Renee test, air conduction is greater than bone conduction. So then I'm going to move on to eyes, because cranial nerve 8 is intact. So I'm going to move on to eyes. I'm going to be looking at your lashes, your brows, and your papillar fissures. Your brows are symmetrical bilaterally. Your eyelashes are equal distributed in hair, and your papillar fissures are intact. So then I'm going to look at the sclera and the conjunctiva. So I'm going to get you to look up. All right. The sclerola is white and the conjunctiva is pink. No lesions or discharges noted. So then I'm going to move on to assessing visual acuity with peripheral and central vision with cranial nerve number 2. All right. So I'm going to step back here. I'm going to get you to read the smallest line. Cover up one eye for me. All right.
D H J B S.
All right. Let's cover up the other eye. Do the exact same line.
D H J B S.
Okay. And then both eyes.
D H J B S.
All right, vision is 20/20 with central vision. So I'm gonna get you to cover up one eye and look straight and tell me what numbers you see.
2 1 2 1.
All right, cover up the other eye. I'm gonna do this over here.
2 1 2 1.
All right, peripheral vision is intact, so cranial nerve number 2 is intact. I'm gonna move on to cranial nerve number 3, ocular motor. So I'm gonna use my pen light because we're testing for direct and consensual pupillary response to light. So I'm gonna put my light right here. Okay, do the other side. All right, pupils are equal, round, and reactive to light and 3 millimeter in size bilaterally. So then I'm gonna test for accommodations and conversions. I'm gonna get you to look at my pen light. All right, accommodation and conversions is intact. So then I'm gonna move on to cranial nerve number 3, ocular motor, cranial nerve number 4, trochlear, and then cranial nerve number 6, abducens, testing for the 6 cardinal gazes of extraocular movement. So I'm gonna get you to look at my pen light and follow it. All right, cranial nerve 3, 4, and 6 is intact. So then I'm gonna move on assessing for red reflex light and inner and internal other structures for any damages. So I'll use my ophthalmoscope. All right, and you just continue to look forward. All right. Okay, the red reflex light was noted. There's no damages to the other optic structures, no hemorrhages noted, and no discharge or discolorations. So then I'm going to move on to assessing my nose. So the nose is midline and straight for the body. Then we're going to move on to cranial nerve number 1, testing for olfactory. So I'm going to hold one of your nostrils and you're going to let me know what you smell.
Alcohol.
Other nostril.
Alcohol.
All right, cranial nerve number 1, olfactory is intact. Also tested for nasal patency with that, and your nasal patency is clear. So then we're going to move on to frontal and maxillary sinuses. So I'm going to palpate here. Okay, no tenderness was noted with those. So then I'm going to move on to your throat and your mouth. So I'm going to be looking at the lips, the teeth, the gums, the buccal mucosa, the palate, the tongue, the top of the roof, under the tongue, your posterior pharynx, and your tonsils. So I'm going to get you to open your mouth. All right, go over to the right, to the left. Okay, so everything, internal structures look clear. Your teeth is appropriate, your gums is pink, your buccal mucosa is moist, the tonsils are non-existent. So then we're going to move on to cranial nerve number 9 and 10. So we're going to be assessing for soft palate and uval arousal phonation. So I'm going to get you to open your mouth and then say ah. All right, the soft palate and uval arose symmetrically. So then we're going to move on to cranial nerve number 12, and we're testing for tongue. Make sure the tongue is midline without fasciculation. So I'm going to get you to open your mouth, stick your tongue out, go up, down, side, side. All right, cranial nerve number 12 is intact with the tongue being midline without fasciculation. So then I'm going to move on to the neck. So I'm going to palpate your trachea. Okay, the trachea is midline. So then I'm going to palpate for a thyroid gland. So I'm going to move your trachea to the left. Swallow for me. Okay, I'm going to come to the other side. Okay, I'm going to push it over to the right and swallow. All right, the thyroid gland is non-palpable. Let's know it's not enlarged. So then I'm going to move on to palpating the carotid artery. Okay. All right, the carotid artery is 2+ in pulsation. So then I'm going to move on to auscultating the carotid artery for any bruits using the bell of my stethoscope. Okay, hold your breath. Okay. no Bruce was noted there. So then I'm gonna move on to the posterior chest. So I'm gonna get you to turn where your back is facing the camera. Okay, so now I'm just inspecting the overall chest to make sure there's no use of respiratory distress. So there's no use of axillary muscles, no tripod positioning, no nasal flaring, no retractions, no tachypnea, no cyanosis. There's no deformities. Everything looks symmetric. So then now I'm gonna palpate for chest expansion. So I'm gonna get you to take a deep breath in. All right, the chest rolls symmetrically. So then I'm gonna palpate for tactile firmness. So every time I touch you, say 99.
99, 99, 99, 99.
Okay, equal vibrations heard throughout all lung fields. So now I'm gonna percuss each lung field in the intercostal spaces. All right, resonance heard throughout all lung spaces. So then I'm going to move on to auscultating those lung spaces, starting from the scapula going down to the lung bases. All right, it's clear to auscultation in all lung fields. So I'm also going to auscultate for egophony now. So every time I touch you, just say E.
E, 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 E.
All right, egophony is negative. I'm going to test for bronchophony now. Say 99 with each touch.
99, 99, 99, 99, 99, 99, 99, 99.
All right, bronchophony is negative. Then we're going to move on to whisper peculiarity. So I'm going to get you to whisper 99. All right, whisper peculiarity is negative. So then we're gonna go anteriorly now. So I'm gonna get you to turn around facing the camera. We can leave the chair just like that. So anteriorly, we're just inspecting the chest for any deformities. Everything seems symmetric. So I'm gonna do the exact same thing I did on the posterior chest. So I'm gonna palpate for chest expansion first. So I'm gonna get you to take a deep breath. All right, the chest rolls symmetrically. I'm gonna also do tactile firmness. Say 99 with each touch.
99, 99, 99, 99.
All right, equal vibrations heard through the lung fields anteriorly. So I'm also going to auscultate your lung fields anteriorly. All right, you're clear to auscultation in all lung fields anteriorly. So now I'm going to auscultate the 5 cardiac areas, starting with my aortic. So my aortic is on my second intercostal sternal border. Then my pulmonic is my third intercostal sternal border space. So then my Erb's point is my my third intercostal space. Tricuspid is my fourth intercostal space, sternal border, and then my mitral is my midclavicular left sternal border, fifth intercostal space. And that's also my point of maximum intensity. So I will palpate that, and then I will listen to the apical pulse for a full minute, and I will let you know the rate and the rhythm. So the rate is 68. S1 and S2 is noted, normal sinus rhythm, no gallops, no murmurs, and no other cardiac sounds. So then I'm going to move on to auscultating that with my bell. So aortic, pulmonic, Erbs, tricuspid, and mitral. Okay, so then I'm going to move on to laying you flat. Okay, so first I'm going to test for JVD. So I'm going to lift your head up some, and I'm going to turn your head that way. All right, the JVD is non-palpable, non-visible. You can go down. So there's no heaves, no lifts. So I'm going to palpate those cardiac areas for any thrills, aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, I'm also going to auscultate those landmarks while being supine. So aortic, pulmonic, Erb's point, tricuspid, mitral. Okay, and I'm gonna use the bell on my stethoscope now. Aortic, pulmonic, earth point, tricuspid, mitral. Okay, and then I'm gonna move on while we're laying flat. I'm gonna go ahead and move on to the abdomen. So the abdomen's contour is flat and symmetrical. And then I'm gonna auscultate for any bruits. So we're gonna start with the aorta, renal arteries, iliac arteries, femoral arteries. No bruits was noted in those. So then we're gonna move on to auscultating for bowel sounds in the 4 quadrants. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Normal active bowel sounds noted throughout the 4 quadrants. So then I'm gonna move on to percussing. So I'm gonna go to percussion stomach. Take a deep breath in. All right. So tympani heard throughout all 4 quadrants. There was dullness over the liver and tympani over the spleen. So then I'm going to palpate for any masses or any tenderness. All right. I'm going to palpate the liver now. Okay. And I'm going to palpate the spleen. Okay. Those were non-palpable. So I'm going to get you to sit back up for me. Okay. Yeah. And I'm gonna get your back to face the camera for just a second. All right, now we're gonna assess for CVA tenderness. Any tenderness with those?
No.
Okay, I'm gonna get you to turn around. You can put the chair correctly now. All right, so now we're gonna test for range of motion, and we're gonna start with your upper extremities. So we're gonna be looking at the hands, the wrists, the elbows, and the shoulders. So first I'm gonna start by testing for capillary refill. Okay, capillary refill was less than 2 seconds. I'm gonna palpate the radial pulse. All right, the radial pulse was 2+. Just inspecting the overall upper extremities. You'll lower your hand for just a second. We're gonna assess for the upper extremities for just a second. So no redness, no swelling. There's no deformities. Everything looks symmetrical. All right, there's no crepitus, no nodules noted, and also no tenderness. So we're gonna start with the range of motion of the fingers. So you just mock me. So flexion, extension, hyperextension, adduction, thumb opposition. All right, this one. Nope. There you go. So you got full range of motion in your hands. And then we're gonna move on to wrist. So flexion, extension, hyperextension, radial deviation, ulnar deviation, rotation. All right, you got full range of motion in your wrist. So then we're gonna move on to your elbows. So we're gonna start right here, flexion, extension, hyperextension, sorry. All right, you got full range of motion in your elbows. So then we're gonna move on to your shoulders. So flexion, extension, hyperextension, internal rotation, external rotation, adduction, and then adduction with this one and then the other side. All right, and circumduction. Okay, good. And then we're gonna move on to grip strength. So I'm gonna get you to squeeze both my fingers as tight as you can. All right, 5 out of 5 grip in your hands. So then we're gonna move on to your biceps and triceps strength. So I'm gonna get you to put your arms like this. Okay, push towards me and then push away from me. All right, bicep and tricep strength is 5 out of 5. So then we're gonna move on to shoulder strength. So I'm gonna come behind you, hold your arms straight out. All right, push up and then push down. All right, shoulder strength is 5 out of 5. And then I'm also gonna stand right here testing for cranial nerve 11. So accessory, I'm gonna get you to shrug your shoulders up. All right, cranial nerve 11 is intact, shoulder shrug is intact. So then we're gonna move to cerebral coordination. So first we're gonna start off with serial finger opposition. So just do what I do. And then go backwards. All right, she already did both hands, so then we're gonna move on to hand flip-flops. So we're gonna start with pronation and supination, and then go back and forwards. Okay, good job. So then we're gonna move on to finger to finger. So I'm gonna get you to touch your nose and touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger. Okay, we're gonna move to the other hand. Touch your nose, touch my finger. And then one more. All right. So cerebral coordination is intact. So then we're gonna move on to stenosis. So I'm gonna get you to close your eyes, and then I'm gonna get you to identify an object that's in your hand. So tell me what that is.
Pen.
Okay. You wanna do the other one?
Spoon.
Good job. Alright, stenosis is intact. So then we're gonna move on to graphthesia. So I'm gonna get you to close your eyes again, and I'm gonna draw something in your hand. You're gonna let me know what it is.
C. R.
Yep, we're gonna move on. Alright.
T. A.
Alright, good job. Alright, so graphthesia is intact, so then we're going to move on to just assessing the overall upper and lower extremities. The skin is intact, the color is appropriate for ethnicity. There is no edema noted, no tenderness. So then we're going to move on to assessing for light sensation. So I'm going to have you close your eyes, and you're going to let me know where I'm touching you at.
Arm. Leg.
Alright, light sensation is intact. So then I'm going to move on testing for vibrational sensation. So I'm going to start with your wrist and let me know if you feel it.
Yes.
Alright, your ulnar prominence.
Yes.
Okay. Then we're going to test for your medial malleosis.
Yes.
Alright, vibrational sensation is noted. So then we're going to test for deep tendon reflexes now. So first we're going to start off with your breaker radialis. Okay, then we're going to the other side. Okay, and then we're going to do bicep. Just hold it around. Good job. Okay, and then we're going to do tricep. Okay, do the other tricep. Okay, then I'm going to do the patella. Okay, do the other side. Okay, and then I'm going to do the Achilles. Okay, and then we're going to test for Babinski. Yep. Alright, deep tendon reflexes are intact. So then I'm going to get you to go ahead and, so we're going to stay right here, but we're going to test for range of motions in your toes, your ankles, your knees, and your hips. So first we're going to start off by testing for capillary refill. Okay. Alright, capillary refill is less than 3 seconds. I'm going to also palpate the dorsalis pedis pulse. Now the posterior tibial pulses. Okay, both of those are bilaterally 2+. So just inspecting the overall lower extremity. There's no redness, no swelling, no deformities. Everything looks symmetrical. There was no edema, no crepitus, no nodules noted as well. So first, we're going to start off by the range of motions with your toes. So kind of like the upper extremities. So with your toes, flexion, extension, hyperextension, adduction, adduction. Okay, you have full range of motion in your toes. So then we're going to move on to your knees. So you're going to do flexion, extension, rotation. Okay, and then we're going to move on to your ankles. So plantar flexion, dorsiflexion. Good job. Inversion, eversion, and then rotation. Okay, and then we're going to test for your strength in your toes. So in your feet, so push up and then push down. Okay, you have full strength, 5 out of 5 strength in your feet areas. And then with your knees, I'm going to get you to push up and then push back. You have full strength in your knee area. So then we're going to do the hip. So push your legs in, yep, and then out. All right, you have full hip strength, 5 out of 5. So now I'm going to get you to stand up. Now we'll put your to the side. Okay, come back some. So now we're just going to do the range of motion in our hips. So we're going to start off by doing flexion, extension, hyperextension. Good job. Internal rotation, external rotation, then circumduction. We're going to do adduction and then adduction. Okay, good job. We're going to do the other side. Flexion, extension, hyperextension, inversion, eversion, circumduction. You got abduction, adduction. Okay, you got full range of motion in your hips. So then we're going to do your knees. So flexion, my leg, extension, hyperextension. Okay, you got full range of motion in those. So we're gonna do the other side. Flexion, extension, hyperextension. Good job. You have full range of motion in your knees. So then we're gonna move on to your lumbar spine. So I'm gonna get you to turn around this way. Good. So I'm just making sure the spine is midline, which it is. There's no tenderness noted, correct?
Correct.
Okay. I'm gonna get you to bend forward just a little bit. The curvature is normal for this patient. The scapulas are bilaterally symmetrical, which lets me know there's no scoliosis or kyphosis. So we're also going to do range of motion in the lumbar spine. So this is already flexion, extension, hyperextension. We're going to do lateral flexion. Okay, good job. And then rotation. Good job. Okay, so we're also going to do cervical spine. So this is just your head. You're going to go forward flexion, in the middle extension, hyperextension. Then you're going to do lateral flexion to both sides, and then rotation. Okay, so then I'm going to get you to face the camera. And then we're going to do a run burst test. I'm going to get you to hold your hands out kind of like this. All right, there's no swing noted. So then we're going to move on to gait. So from right there, go over some. And then I'm going to get you to walk to me toe to toe. Good job. And then go backwards. All right, the gait in tandem is intact. So then we're going to get you to hop onto one foot. There you go. And then the other foot. All right, my head to toe assessment is complete.